Hello students, a very good evening. Welcome to the session where we are going to discuss very important topic of pediatrics, that is growth and development. So growth and development is an integral part of your core pediatrics, right? This is something that no one is going to teach you. When we talk about systemic pediatrics, a lot of overlapping topics are there. When we talk about nutrition, a lot of overlapping topics are there. But growth is development and some is something that is very integral to pediatrics and also a very high yield topic. So a lot of details can be discussed over this topic, but here we are going to touch only on the high yield subject, high yield topic. So firstly, let's start with normal growth pattern. Normal growth pattern. So this is important for all of your exams, be it FMG, be it INICET, be it NEET PG. This normal growth pattern is something that is asked very frequently in the exam. So let's understand what is this growth and what is this development. So when I talk about growth, it means increase in the number or increase in the size of the cells, right? Increase in the number or increase in the size of the cells. Whereas development means maturation of function of cells. So these two things are very different. Growth, whenever I'm talking about growth, I'm talking about the quantitative aspect, right? Quantity, increase in the number or increase in the size of the cells. Whereas development is the qualitative aspect. It depends upon the maturation of function of cells. So CNS maturation comes under this development. CNS maturation. There are certain laws in the nature and we have certain laws of growth too. So first law says that the growth of every individual is going to be unique. That is, your growth is going to be unique, my growth is going to be unique. So growth of every individual is unique. And the progression of growth is in a peculiar direction. What is the direction? The direction is cephalocaudal and distal to proximal. What do I mean by that? Have you ever seen a newborn? What happens in a newborn? The head size of a newborn is big as compared to the body of the newborn. And as the child grows, the trunk grows, the limb grows. So the direction of progression of growth is from the head, cephal, to down, cephalocaudal direction, and within the limbs, it is distal to proximal. That means my hands will grow first, then my forearms, then my arms, right? So remember that progression of growth is in the cephalocaudal and distal to proximal direction, right? And the third law says that different tissue grow at different rate. Different tissue grow at different rate. So let us look at these curves. These are the human growth curves or Scammon curves. What can you see over here? Look at this curve, curve A. Can you see the growth of the tissue over here? In the first 2 years of life, there's the maximum growth. Approximately 90% of the growth of this tissue happens. And thereafter, there is little to no growth. So what is this graph depicting? This graph is depicting my neural growth. Neural growth. Right? When we talk about the neural growth, the CNS growth, then till 2 years of life, majority of the growth happens. Till 90% of the growth happens till 2 years of age. Thereafter, the remaining growth happens. So this is depicting the neural growth. Look at this curve B. What is happening over here? In 4 to 8 years of life, there is peak of this tissue, Before 4 years, there is no growth. After 8 years, there is regression of that tissue growth. This is depicting nothing but lymphoid growth. If you see a child in the age group 4 to 8 years, you will see that the lymph nodes have increased. The size of the thymus is more. So this is nothing but your lymphoid growth. So here comes the MCQ pointers. They ask what is the head size at the time of the birth and at 2 years of age, what size is achieved. So at birth, remember 60% of the adult size is there, and at 2 years of age, 90% of the adult size is achieved. Now let's look at the other growth curves. We have this S-shaped curve or somatic curve. What is happening over here? In the initial life, there is exponential growth. Then there's a plateau. Then again, at the time of puberty, there is growth spurt. So this S-shaped curve or sigmoid shaped curve is for somatic growth. And lastly, we have this graph for sexual growth, where before puberty there is little to no growth and thereafter there is spurt. So we have four Scammon curves with us. The first Scammon curve was this for neural growth, A. Then we had lymphoid growth where we had a peak. Then we have the sigmoid shaped curve for somatic growth, and then we have sexual growth. Right? So this is about your growth curves. Now let's understand the periods of growth. What are the different periods of growth? So periods of growth can be broadly divided into prenatal, postnatal and adolescent age group. Prenatal, postnatal and adolescent age group. So prenatal, that is before the birth. Before the birth, when the egg is fertilized by the sperm and there is formation of zygote, so we call this zygote till 2 weeks of gestation age. After that, we label it as embryo till 8 weeks, 3 to 8 weeks. So how do we remember? If you write Z for zygote, right? It can be very similar to the two letter, right? So till 2 weeks, it's zygote. And E is for 8. So embryo till 8 weeks, right? So very easy to remember, fertilized ovum or zygote till 2 weeks and embryo 3 to 8 weeks. 9 week onwards, we have fetus. Again, a simple thing to remember, if I draw F like this and make a mirror image of that, that will make 9. So 9 week onwards, we have fetus. So fetus is from 9 weeks till birth. So till now we have read 3 terminologies in the prenatal age group: zygote, embryo and fetus. Zygote till 2 weeks of life, embryo till 8 weeks of life and fetus from 9 week onwards till birth. Then we have a period that is known as perinatal period. This perinatal period is from 22 weeks of gestation till 7 days of life. 22 weeks of gestation till 7 days of life. This is all about the prenatal periods of growth. Let's understand the postnatal period. As soon as the child is born, this child is called as a neonate. The first 28 days of life, the child is called as a neonate. It can be classified into an early neonate and late neonate. What is an early neonate? An early neonate is a child who is in the first 7 days of life, and after 7 days it is a late neonate. 8 to 28 days is late neonate. Then we have an infant less than 1 year of age. So in between neonatal period, that is first 28 days till 1 year, is known as a post-neonate. So every neonate will be an infant, but not every infant is a neonate, right? Very easy to understand. So every neonate is going to be an infant, but not every infant is a neonate. Then we have toddler, T for toddler, T for 3. So 1 to 3 years is a toddler. Then we have a preschool, 3 to 6 years. Then we have a school going, S for school going, S for 6. So from 6 to 12 years, it is a school going child. So very easy. Neonate, first 28 days of life, early to late. Then we have a post-neonate, infant, toddler, preschool and school going child. And lastly, we have an adolescent age group, that is from 10 to 20 years of age, further divided into early adolescence, mid-adolescence and late adolescence. Early adolescence is 10 to 13 years, mid-adolescence is 14 to 16 years and late adolescent period is 17 to 20 years of life. So this is about the period of growth. Now with adolescence comes another term that is known as puberty. Are they same? Are adolescent and puberty the same? No. Adolescence we just discussed. What is adolescence? Adolescence is the age group 10 to 20 years of life. Puberty is actually the appearance of the secondary sexual characters. So appearance of breast, thelarche, pubarche, menarche in females, and testicular enlargement, puberty, hair enlargement, beard enlargement, all of these secondary sexual characters in boys. So remember, these two terms are different. Adolescent is just an age group 10 to 20 years, whereas puberty denotes the appearance of secondary sexual characters. Now we have different parameters to assess the growth. Some of them are age dependent parameters, some of them are age independent parameters. What do I mean by age dependent parameters? If I tell you that weight of a 1-year-old child is 3 kg, is it normal? No. But if I tell you weight of a newborn is 3 kg, that's normal. So weight is something that is dependent upon the age. So if some parameters are age dependent parameters like weight, height, head circumference, then comes age independent parameters. These include mid-upper arm circumference and skin fold thickness. Now let's go through each of these parameters quickly. Firstly, we have weight. We have different instruments to measure the weight. We have an electronic beam scale. We have a spring balance in which you can keep the child like this and weigh, or simply by normal weighing machine. What can we do? Firstly, we take the mother's and the child weights combined, and then when minus the mother's weight or the attendant's weight. This is commonly used in the practice. So average birth weight of a term baby in India is 3 kg. But this weight initially falls. In the first 7 days of life, there is physiological weight loss. What happens in this physiological weight loss? There is loss of extracellular fluid. How much weight loss is there? If it is a term baby, up to 10% of the weight loss can be seen. And if it is a preterm baby, then 15% is seen. And this weight is regained. That means the child regains the weight, birth weight, by day 10 of life in a term baby and day 14 of life in a preterm baby. Thereafter, there is increase in the weight. How much increase? 20 to 40 grams per day till 3 months of life. And after 3 months, 300 grams per month till 1 year of age. We also have a ready reckoner with us. Ready reckoner. What is this ready reckoner? If you know the weight at birth, then we have the simple trick to derive weight at different age. So if, for example, the weight at birth is X, then at 5 months it doubles. 5 months it doubles, 2x. At 1 year it triples. At 2 years it quadruples. Then at 3 years of age, it becomes 5 times. 5 years of age, it becomes 6 times. 7 years of age, it becomes 7 times. And 10 years of age, it becomes 10 times. So it is a ready reckoner that is available with us. INICET people specifically and FMG people, they are very fond of asking this when the weight doubles, when the weight triples, when the weight quadruples. So remember, this ready reckoner, if the birth weight is X, then it doubles at 5 months, triples at 1 year, 4 times at 2 years, 5 times at 3 years, 6 times at 5 years, 7 times at 7 years, and 10 times at 10 years of age. Also, we have this Veach formula that can be used for calculation of the weight, estimated weight in different age group. So if the child is in between 3 months to 1 year, 3 months to 1 year, then we can calculate the expected weight by this formula, x plus 9 by 2, where x is age in months. So if I say I have a 9-month-old, so 9 plus 9 divided by 2, that is 18 by 2. Again, the weight would be 9 kgs, right? So this is how we calculate. After that, after 1 year of age, from 2 to 6 years of life and 7 to 12 years of life, we have different formulas. 2 to 6 years, we have 2x plus 8, where x now is the age in years. So let's say if I say a 4-year-old child, so 2 into 4 plus 8, that would be 8 plus 8, that is 16 kgs, right? So, and after 7 years, 7 to 12 years, we have the formula 7x minus 5 by 2, where x is again age in years. So these are the 3 Veach formula for 3 different age group that is going to tell me the expected weight of the child at that particular age. After weight, we have height or length. If the child is less than 2 years of age, we take length. After 2 years, we take height. Why we are doing this? till after 1 year of age, the child can stand, right? Independently, the child can stand after 1 year of age. But why till 2 years we are using this infantometer and taking the length, making the child lie down and taking the length? Why we are doing this? Because till 2 years of age, there is physiological bowing of legs. And if we make the child stand, the height will come lesser because there is bowing of legs, right? So till 2 years, you are going to take the length. After 2 years, you are going to take height by using the stadiometer. The average length of a newborn at birth is 50 centimeter. In the first year of life, there is gain in 25 centimeter. So at 1 year of age, what would be the length of the child? It would be 75 centimeter. In the next 1 year, again there is gain of about 10 to 15 centimeters. So by the end of 2 years, it will be 85 to 90 centimeter. Thereafter, the child steadily grows at the rate of 6 centimeter per year, right? Till puberty. After puberty, there is going to be a growth spurt. Males can grow up till 10 centimeter per year and females 8 centimeter per year. Here also we have a Veach formula, but this Veach formula is for the age group 2 to 12 years of age. Height can be calculated as 6x plus 77 centimeter. 6x plus 77 centimeter, where x is the age in years. So if I say, let's say 10 years of age, then 6 into 10 plus 77, 60 plus 77, that would be 137 centimeter at the age of 10 years, at the age of 10 years, right? Now let's discuss this very favorite question of the examiners. They ask, at which age the child reaches half of the adult height? At which age the child reaches half of the adult height? So how do we calculate half of the adult height? If you take the average of the adult height, it would be 160. Average adult height is 160 centimeter. So half of that would be 80 centimeter. We just discuss what happens after birth. There is increase in 25 centimeter. So at 1 year it's 75. Then again in the after 1 year there is increase in 10 to 15 centimeter. So by the end of 2 years we have 85 to 90 centimeter of length. So this 80 centimeter will be very close to 2 years of age. So best answer here would be 18 to 24 months. 18 to 24 months. So at what age the child reaches half of the adult height? It is 18 to 24 months. While we are discussing this height, I want to discuss this very important ratio that is known as upper segment lower segment ratio. Upper segment lower segment ratio. What is upper segment? If the child is standing like this, from the top of the head till the pubic symphysis, this is the upper segment. And how do you calculate the lower segment? If you subtract this upper segment for the total height, this is the lower segment. So this ratio is very important. Remember when we discussed the laws of growth, we discussed that the direction of progression of growth is cephalocaudal. So as the child grows, the limbs will grow. That means the lower segment will grow. So as we age, this upper segment lower segment ratio should decrease because my lower segment will be growing. So at birth, this normal upper segment lower segment ratio is 1.7:1. And as the child grows, this ratio is going to decrease. So at 3 years of age, it becomes 1.3:1. Then it becomes 1.1:1, and thereafter at 10 years of age it becomes 1:1, and after 10 years adult ratio is achieved. What is the adult ratio? 0.9:1 or 1:1.1. So this is all about the normal upper segment lower segment ratio. Why this ratio is important? This ratio will become important while evaluation of short stature. If this ratio is normal, then this is a proportionate short stature. If this ratio is abnormal, that means either increased or decreased, that would be a disproportionate short stature. For example, if this ratio is increased, what do I mean by that? That means the upper segment is big, lower segment is short. So this is short limb dwarfism. And if this ratio is decreased, that means upper segment is short and lower segment is normal. This is short trunk dwarfism. So this will be important while we are evaluating short stature. Also, we have this arm span. How do we measure the arm span? Arm span is measured if we make the child stand like this with arms outstretched and measure the distance from the tip of the middle fingers of both the hands. This is the arm span. We compare this arm span with the height of the child. At birth, what happens? This arm span is going to be less than the height, and this difference is usually 2.5 centimeter. At 11 years of age, this arm span is equal to the height. And after 11 years of age, my arm span would be now more. Arm span would be now more as compared to the height. Arm span would be more as compared to the height. The importance of this arm span is in the evaluation of tall stature. If any point you feel that this arm span is proportionately higher as compared to the height. For example, I know at 11 years of age, this arm span should be equal to the height. But if before 11 years of age you see that arm span has increased or outgrown the height, that is an early marker for tall stature. Right? After height, weight, let's talk about the next parameters, that is head circumference. How do you measure the head circumference? By a measuring tape. So we take the measuring tape and place it over the head of the child. Anteriorly, it is placed just above the supraorbital ridge, and posteriorly it is placed on the highest point of the occiput. So this is also something that the examiners ask. They ask, where do you place this measuring tape? So measuring tape, remember, anteriorly is on the supraorbital ridge and posteriorly is on the highest point of the occiput. And the overlap of this tape, measuring tape, has to be done over the parietal region, just as shown in the diagram. Normally, we know the average head circumference at birth is 33 to 35 centimeter, which is 60% of the adult size. And how it grows thereafter in the first year of life? In the first 3 months, the rate of growth is 2 centimeter per month. After that, 3 to 6 months, it's 1 centimeter per month. After that, it is 0.5 centimeter per month. Right? So very easy. Very easy. Right? In the first 3 months, we have 2 centimeter per month. Then in the next 3 months, we have 0.5 centimeter per month, and so on. So let's see the pattern in the first year of life. So first 3 months, 2 centimeter per month. That means 2 into 3 is 6 centimeter. Then we have 1 centimeter per month for the next 3 months. 1 into 3, 3 centimeter. Then we have 0.5 centimeter for the next 6 months. 0.5 into 6, again 3 centimeter. So 6 plus 3 plus 3. In the first year of life, the gain is 12 centimeter. The gain is 12 centimeter. So let's take an average of at birth as 34 centimeter. So add 34 plus 12, it becomes 46 centimeter. So at 1 year of age, 46 centimeter would be there. In the next 1 year, 2 centimeter gain is there. So by the end of 2 years, we have 48 centimeter. We have 48 centimeter head circumference. Right? This is 90% of the adult size. And after 12 years of age, the adult size has been achieved, that is 52 centimeter. When we were discussing height and length, we discussed two ratios. We discussed upper segment, lower segment ratio, and we discussed arm span relationship with the height. Right? And now that we have head circumference with us, we have to discuss this ratio that is known as head circumference to chest circumference ratio. At birth, obviously my head size is big, so head circumference is more than the chest circumference. At 1 year of age, it becomes equal. After 1 year of age, head circumference is less than chest circumference, but the difference usually stays within 3 centimeter. This completes our age-dependent parameters. Now let's move to the age-independent parameter, that is mid-upper arm circumference. This mid-upper arm circumference is an age-dependent parameter for which age group? 6 months to 5 years of age group. What happens in this age group 6 months to 5 years? Usually small children, they are very chubby, and as they grow, this baby fat is gone and muscle has developed. So if you take a mid upper arm circumference of this age group, initially the circumference is majorly made up by the fat, and this fat is then replaced by muscle. So till 6 months to 5 years of age, the circumference overall remains constant. That's why this is known as an age independent parameters. So how do we measure this mid upper arm circumference? We take two bony points, acromion process of the scapula above and olecranon process below. We draw a line joining these 2 points, and at the midpoint of this line, we measure the mid upper arm circumference. Right? We also have a very important tape over here. Can you look at this tape? This colorful tape. This colorful tape is known as Charcot's tape. Can you see there are 3 zones in this tape? Red, yellow, green. Red is the circumference less than 11.5 centimeter. It denotes severe malnutrition. Severe malnutrition. Then we have yellow, which denotes that denotes 11.5 to 12.5 centimeter. Then we have green after 12.5 centimeter. That denotes normal nutrition. So why this colorful tape is there? This is for the community screening. Remember, this is for the community screening purposes. That is, even if I don't know how to read numbers, just by looking at the colors, community, we can screen how many children are below the malnutrition line. Right, so this is about the mid upper arm circumference, age independent parameter. Then we have skin fold thickness. Skin fold thickness. So this skin fold thickness is measured by this device. This device is known as Harpendon's caliper. Harpendon's caliper. The most common site where we measure the skin fold thickness is triceps. Apart from that, we can measure the subscapular region, scapular region. Normally, the skin fold thickness should be more than 10 mm. More than 10 mm. If it is less than 6 mm, this denotes severe malnutrition. The purpose of knowing this normal growth pattern was to make you customize what is the normal growth that happens in pediatric population. But obviously, if I am telling you the average weight at 3 kg doesn't mean a child who has 2.9 kg or 3.2 kg is abnormal. We are always going to have a range. हमेशा हमारे पास एक range होगी, है ना? वो range को हम कैसे interpret करते हैं? Through this growth charts. We have 2 types of growth charts, standardized growth charts and reference growth chart. Standardized growth charts में हमारे WHO growth charts आते हैं, जो less than 5 years के लिए हम लगाते हैं. एंड रेफरेंस ग्रोथ चार्ट्स में हमारा रियल टाइम डेटा होता है, जैसे IIP ग्रोथ चार्ट्स हैं, दैट वी एम्प्लॉय फॉर above 5 years of age. What is important for your exam is this WHO growth charts. This WHO growth charts, again, they are standard growth charts, multi-center growth reference study, MGRS. They took into account of only the breastfeed babies in 6 countries. What are these 6 countries? You can remember these 6 countries by the mnemonic, you are a big no. You are a big no. That's how I reject boys. You are a big no. What is U? U is for USA. B, Brazil, India, Ghana. N is Norway. O is Oman. Right? We also have different colors for boys and girls. For boys, we have blue color charts. For girls, we have pink color charts. Right? So, depending upon that, we have these growth charts now with us. Can you see in this growth charts, we have different centiles. We have 3rd centile, 97th centile, 85th, 50, 15th. So, anything beyond 3rd and 97th centile is definitely considered to be abnormal. And if you take it in the form of standard deviation, then obviously anything beyond plus minus 2 standard deviation will be abnormal. Right? This is how we interpret the growth charts. With that, we complete our section of growth. If there is any doubt regarding this growth section, then I'll be more than happy to have that doubt over here. Or else we can move to our second topic, that is development. We'll be reading about developmental milestones. Okay, so no doubt per se. Let's move down to the normal development and milestones. So while we were discussing growth, we discussed that there are certain laws of growth, right? Everything in nature has some laws. We discussed that growth of every individual is unique, growth of different tissues in an individual is unique. We discussed about the Scammon curves, and also we discussed the direction of progression of growth, that was cephalocaudal and distal to proximal. Here in development also we have certain laws. The first law says that development is a continuous process. That means it is an ongoing process. You are developing still now, right? We all are maturing day by day. So remember, development is a continuous process and it depends upon the maturation of CNS function, Another important law is that the sequence or the order in which development is happening will stay the same. What do I mean by that? Firstly, a child learns to hold the neck, then the child learns how to sit, then the child learns how to stand, and then the child learns how to walk, run. The sequence will stay the same. It won't happen that the child first learn how to run, then knows how to stand, then knows how to sit. The sequence will, an order will stay the same. And the direction of progression of development over here is cephalocaudal and proximal to distal, not distal to proximal as in growth. Cephalocaudal stays the same, neck holding, then trunk holding, sitting, then standing. And in limbs also, firstly the gross body movement the child will be able to do, and then the distal movements. So proximal to distal. So direction of progression of growth is cephalocaudal, proximal to distal. Then the next law is very important. It says that the primitive reflexes must go. Primitive reflexes must go to achieve new milestones. What do I mean by that? When the child is born, there are certain primitive reflexes that the child has. These have to go so that the child has to attain new milestones. If you want to enter a new relationship, you have to forget your ex, right? So similarly, primitive reflexes must go to achieve new milestones in life. One of the reflexes, for example, is palmar grasp. What happens in palmar grasp? If you give some object or stroke the palm of a newborn, then there is a reflex known as palmar grasp. Reflexly, the child will grasp that object. This has to go so that the child can voluntarily grasp things. This is a reflex, involuntary process. But if the child voluntarily has to grasp things, this palmar grasp need to go, right? So primitive reflexes must go to achieve new milestones. And the last law says that the initial disorganized mass activity is replaced by a specific action. For example, when you just entered your MBBS from home setting, protected environment to a hostel setting, initially everything was disorganized, right? Your food plan, your cleanliness, everything was disorganized. But slowly, you gain a habit of it and now everything is organized, hopefully. So initial disorganized activity is replaced by specific action. If the child was initially very disorganized, holding things like this by dexterous grasp, now the child has learned unidextrous and pincer grasp. So initial disorganized activity is replaced by a specific action. So these are the 6 laws of development that you should be very well versed with. Now in development, we have 4 domains majorly. These are gross motor milestones, fine motor milestones, social milestones, and language milestones. And lastly, we have certain special milestones, vision and hearing, which we won't be discussing today. We will be focusing on these gross domains only: gross motor, fine motor, social, and language. So let's start with the gross motor milestones first. Gross motor milestones. The name itself has gross motor. So here I'll be discussing about the gross body movements. Firstly, cephalocaudal direction, remember, right? So firstly, the child will learn how to head control, then how to trunk control, that is sit, and then how to control the lower limbs, that is stand, right? So firstly, head control comes at 3 months of age. 3 months of the age. Then the child will be sitting comes at 6 months of age. Firstly, the child will sit with support of his palms in a tripod position. at 6 months. Then without support, the child will be able to sit at 8 months of age. Then comes standing. Standing with support comes at 9 months of age. Before that, there will be crawling. What is crawling? There are two terms, crawling and creeping. Crawling and creeping. In both of the things, crawling and creeping, the child will be on all the four limbs. All the four limbs. If the abdomen is touching the floor, this is crawling. And if abdomen is lifted off the floor, it's creeping. So firstly comes crawling at 8 months and then creeping at 10 months. Then the child will be holding the furniture and cruising at 10 to 12 months. Then comes the first birthday of the child, that is 12 months. In 12 months, child will be able to stand without support. So at the first birthday, the child will be standing independently and cutting the cake, right? Standing without support. And but the child will be walking but with support, with one hand held, walks with support. So just imagine a picture. At first birthday, the child will be standing independently and cutting the cake, but to receive gifts from the others or giving down the return gifts, the child has to hold the hand of the parent and then go. Right? So at 12 months of the age, a child can stand without support and walk with support. At 15 months of the age, there will be walking without support. Then at 18 months, the child will be running, exploring. Right? 18 साल पे सबको ऐसे होता है ना, उड़ना चाहता हूँ, दौड़ना चाहता हूँ. So that will happen. At 18 months of age, the child will be running, exploring the drawers. Then by 2 years of age, the child will be jumping, walking backwards, climbing the furniture. At 3 years of age, the child will be driving a 3-tire cycle, tricycle. Then comes hopping and skipping. Hopping or skipping on one foot comes at 4 years of age, and skipping on 2 feet, the rope skipping, it comes at 5 years of age. So these are the important gross motor milestones. In gross motor milestones, one important milestone is stairs. Not included in the main table, separately we have discussed, because stairs is something that examiners are very fond of asking. So what happens? Initially, the child goes up and down the stairs by keeping both the foot on one step. Both the foot on one step. So if there is 2 feet on one steps going upstairs, downstairs, this happens at 2 years of age. Then we have 1 feet per step or using alternate step. Firstly, the child will learn how to go upstairs and then downstairs. So going upstairs like this is easier as compared to going downstairs. So 1 feet per step or using alternate steps upstairs come at 3 years of age. And finally, 1 feet per step or alternate step downstairs comes at 4 years of age. 4 years of age. So this is about the gross motor milestone and the stair milestones. Right? This is crawling and creeping. I told you in both of these, crawling and creeping, the child will be on the 4 limbs, moving on the 4 limbs. But in crawling, the abdomen is touching the ground. And in creeping, the abdomen is lifted off the ground. Can you see over here? So this crawling comes first at 8 months of age and creeping comes later at 10 months of age. So crawling, abdomen is touching the ground. Creeping, abdomen is lifted off the ground. Which comes early? Crawling comes early at 8 months and creepy comes later on at 10 months. Right? This is cruising. The child is holding the furniture and moving. This is known as cruising, holding the furniture. It comes at 10 to 11 months of age. Right, now let's start with the fine motor milestones. Fine motor milestones would be the milestones involving the distal muscles of the hand, the fine actions. So firstly, I told you this reflex, you remember, palmar grasp. If you stroke the palm of the child will grasp that voluntarily. Involuntarily, there is a grasp. This palmar grasp has to go so that the child can voluntarily hold objects. So this palmar grasp goes by 4 months of age. After that, the child can hold his favorite toy or rattle by his own hand. So grasping of toy and rattle comes at 4 months of age. So now the child has the object of interest in his hand at 4 months. Child will keep that in, bring that to his mouth. This is known as mouthing. So mouthing comes at 4 to 6 months of the age. Then comes the grasp of the hand. Firstly, the child has this disorganized activity. Child will be holding the object in both the hands. This is known as bidextrous grasp. After that, the child will realize I can hold the object like this with one hand also. This is unidextrous grasp. So bidextrous grasp comes at 5 months of age and unidextrous comes at 6 months of age. Then we have radial grasp at 7 months of age. That means the child will be holding the object from the radial side like this, right? So this is radial grasp. After that, the child will realize I have thumb. God has given me this thumb. I can oppose the objects in between the thumb like this. This is known as pincer grasp. Initially, there will be immature pincer grasp. That means the child will be holding the object, but that object won't be in between the thumb and the index finger. There will be the use of the accessory fingers too, like this. This is immature pincer grasp. This immature pincer grasp comes at 9 months of age and it becomes mature. That means the child will be able to make this okay sign, hold the object like this, okay sign. This is mature pincer grasp. This comes at 12 months of age. And once pincer grasp is established, the child can hold pencil like this and scribble. So scribbling comes at 15 months of age. After scribbling, the child will make different shapes. Firstly, the child will make line. If you have some nephew or niece or a younger child at your home, initially the teacher gives homework like this only. She'll make 2 dots and ask the child to make lines with that, joining those dots. It could be standing line, it could be sleeping line. So when the child can make these lines with 2 ends, this is at 2 years of age. So a line has 2 ends, remember. So at 2 years of age, the child can draw these lines. Then circle comes at 3 years of age. 3 years of age. This plus or cross sign comes at 4 years of age. Rectangle at 4.5 years of age. Triangle at 5 years of age. Diamond at 6 years of age. And cylinder at 9 years. Cube at 11 years. When we are discussing this fine motor function, a very important fine motor function I want to discuss. This is something that we do every day. Dressing and undressing, right? While dressing and undressing, we use these distal muscles, the fine motor action. So in dressing and undressing, what do you think is easier? Dressing or undressing? We all like to undress, right? Undressing is easier. So undressing comes first. Firstly, the child will learn how to undress himself. So undressing with help initially. Then comes dressing, again with help. Thereafter, the child will be able to do that without help. So dressing, undressing without help. So remember, firstly it comes dressing, undressing with help. This comes at 2 years of age. Then we have dressing with help at 3 years of age. Then we have dressing and undressing without help at 5 years of age. And within this dressing and undressing, the most integrate action is buttoning and unbuttoning. Unbuttoning comes at 3 years of age. Buttoning comes at 4 years of age. So undressing, unbuttoning, all of these would come first. And dressing, buttoning, all of these come later on. Also, while we are discussing this fine motor function, one such assessment of fine motor function is by the help of cubes. If you have given your final year pediatrics exam, practical exams, or you're planning to give one, I know you have this developmental assessment kit that has cubes, different cubes. So how do we assess the developmental age of the child by these cubes? So there's a story that I want to tell over here. If I want to assess the fine motor milestones of a child using these cubes, I will first ask the child to make tower of cubes. I'll ask the child to make tower of cubes. That means I'll ask the child to stack cube over one another and make a tower. Firstly, make tower of 2 cubes, then 6 cubes, then 9 cubes. 2 cubes comes at 15 months of age, 6 cubes comes at 2 years of age, 9 cubes comes at 3 years of age. So remember, tower 2, 6, 9, 15 months, 2 years, 3 years. Right? Now to go to this long tower, I need some vehicle. I need a train. So I will ask the child to make a train now. Firstly, the child will make a train without chimney. The child will stack the cubes like this, horizontally. This is train without chimney. Then we add a chimney. That is, you're going to add 1 cube above the first cube. This is the chimney. So After tower comes train, without chimney, with chimney. Without chimney, the child can make it at 2 years of age. With chimney, the child can make at 2.5 years of age. Right? So tower, I need to have a train to reach that tower. Now this train will go over the bridge. 3 gated bridge and 5 cube gated bridge. This 3 gated bridge that is made up of 3 cubes is made by 4 years of age, and 5 cubes or 5 gated bridge is made by 5 years of age. Right? So now this train has reached the tower through this bridge. To reach the top of the tower, I need stairs. So I'll ask the child to make staircase with the cubes like this. And this comes at 6 years of age. So this silly story was just to remember the sequence. Firstly, you have to remember tower, 2 cubes, 6 cubes, 9 cubes. Then train, without chimney, with chimney. Then we have bridge, gate, 3 gated bridge and 5 gated bridge. And lastly, we have stairs. So cubes, tower, remember 15 months, 2 years, 3 years. Train, 2 years without chimney, 2.5 years with chimney. Bridges, 3 gated bridge or 3 cube bridge at 4 years of age, at 5 cubes or 5 gated bridge at 5 years of age. And lastly, staircase, S for staircase, S for 6 at 6 years of age. So by this we are done with the important fine motor milestones too. Now let's move to the social milestones. What do I mean by social milestones? How the child acts in the society, right? How the child interacts with the surroundings. So firstly comes the social smile. The child will pass smile to everyone, will give social smile. This comes at 2 months of age. Then thereafter the child will realize not everyone is important. My mother is especially important, she's giving me feeds. So there comes mother regard. Mother regard comes at 3 months of age. Then the child has this milestone known as hand regard. What happens in hand regard? Child will be lying down and looking at his hands. He'll be regarding his hands, right? कि क्या बनाया है? Wow, hand regard. This hand regard begins at 12 weeks of age, but this cannot go on. So it disappears also. It disappears at 20 weeks of age. So begins at 12 weeks, that is approximately 3 months, and ends at 20 weeks, that is approximately 4 months. After hands, the child will be looking at the mirror, again realizing how sexy he is. S for sexy, S for 6 months. So remember, mirror play, the child has at 6 months of age. So now the child has recognized the mother. Mother regard is there at 3 months, and now the child has recognized himself also in the mirror. Apart from that, anyone else would be stranger. So stranger anxiety comes thereafter 6 to 7 months of age. Then comes a very important milestone at 9 months, that is object permanence. Before 9 months, what happens? If you show a toy to a child and then hide it, the child won't look at it, look for it. Why? Because out of sight, out of mind. Anything now out of the vision is out of the universe. But at 9 months, object permanence set in. That means the child now realizes if something has been taken away from his field of vision, doesn't mean that thing doesn't survive in the universe, doesn't exist in the universe. The child has developed this object permanence. The child will look for the toy if you hide the toy. So this object permanence comes at 9 months of age, and this is at 9 months of age only that the child learns how to wave bye-bye. How to wave bye-bye, right? So 9 months, remember, is for the object permanence as well as waving bye-bye. Then comes all the drama. After 9 months comes all the drama. Imitation, mimicry. You all understand what is imitation, what is mimicry? Right? Imitation, mimicry, you all understand. What is that? A lot of mimicry artists you have seen. So mimicking sounds come at 7 to 9 months of age. Mimicking of act come at 19 to 20 months, and domestic mimicry, that is child copying the mother doing the household chores, comes at 18 months of age. Then comes 3 years. 3 years, the child remembers the 3 things: name, age, and gender. The child can tell his or her name, age, and gender. And handedness also comes at this age. What do I mean by handedness? That is preferential usage of one side of the hand. The child will be using right side more as compared to the left side. That is handedness. It comes by 3 years of age. This handedness is often confused by right to left discrimination. What do you mean by left discrimination? That the child knows this is right side, this is left side. Handedness means preferential usage. That means the child will be using one side more as compared to the other. But left to right discrimination means the child will now know this is right, I am using it more. This is left, I am using it more. So identifying left to right is different from handedness. Handedness comes first, 3 years, and right to left discrimination comes later on at 4 years of age. Then comes interaction playing. Initially, the child's world is very confined to the household. The child will be just around the parents. The child will be hugging parents, playing with the parents at 15 months. The child will grow fondness 18 months. By 18 months, the child will be kissing the parents. And obviously, if someone is so much attached to the parents, if they now go to the office, there will be separation anxiety. So the separation anxiety sets in at 18 months of age. 18 months of age. Right? Now the child will go out and seek other company. The parents have gone out, so the child will seek other company. Firstly, what will happen? The child will go towards other children, but won't be interacting much. Remember your first day of MBBS, you must be sitting next to your now best friend, but that time each and everyone is shy. You must be over your own phone, he must be over his own phone. So this is parallel play, that two children would be sitting together, but they will be playing independently, just sitting next to each other. This is parallel play. This comes at 2 to 2.5 years of age. Then they will be exchanging things, exchanging toy. This is known as cooperative play. It comes at 3 years of age. And after that, 4 years of age, the child will now have group play, role play. They will play gar and everything. Right? So this is about interaction and playing. This covers our social milestones. Now let's move to the language milestones. What do I mean by language milestones? By using the vocal power, the child will be interacting. So firstly comes cooing. You all understand what are cooing sounds, a goo. These are the cooing sounds. These come by 2 months of age. Thereafter, the child will be laughing out loud. That means laughing in full volume. This comes at 4 months of age. Then comes monosyllables like ma, ba, pa, ta. These comes at 6 months of age. Now the child will learn how to join these monosyllables. Mama, papa, dada. These are bisyllables. These comes at 9 months of age. And the first real word. What do I mean by first real word? The word the child knows his meaning. So sometimes if you ask your mother or your father that what was my first word, they must be saying mama, papa or dada, right? But these are not your real words. These are just bisyllables that you made by joining monosyllables. The first real word is the word that the child knows the meaning of. That comes at 12 months of age. Thereafter, the vocabulary will increase. By 15 months of age, the child will know 4 to 6 words, and from this vocabulary only, the child will try to communicate. So, there will be a jargon speech. By 18 months, the child picture naming. By 2 years of age, the vocabulary further increases. 50 to 100 words, and remember by the end of 2 years the child will be making simple sentences, 2-word sentences, just pani do, khana do, give water, give food. Simple 2-word sentences the child will be able to make. By the end of 3 years the child will be using pronouns like I, me, you, main, tum, aap, and the vocabulary is close to 250 words. By the end of 4 years, the child will now be reciting poems, telling you stories. And when we start the stories, we say once upon a time. So that means by that time, the child also will be referring to the past tense, that this happened back. So this is 4 years of age. And at 5 years of age, now the child will be referring to the future tense too. Can form long sentences and ask the meaning of words. So from 2 to 5 years of age, there is so much rapidly increase in the vocabulary that is seen. So by this developmental assessment, with this we come to this developmental assessment. In growth assessment, easy, we were using growth charts to plotting the curves. For developmental assessment, we have developmental quotient. How do we calculate this developmental quotient? This is calculated developmental age divided by chronological age into 100. Developmental age divided by chronological age into 100. If this developmental quotient is less than 70, we label it as delay. So if only one domain out of the fourth is affected, then we label it as isolated delay or dissociation. For example, if the fine motor, gross motor, social functions of the child are normal, but only speech is affected, this is an isolated delay or dissociation. And whenever two or more milestones are affected, two or more domains are affected, this is known as global developmental delay. And then we have a term known as deviancy if something is happening out of the sequence. For example, if you have a cerebral palsy child who has diplegic CP, because the tone of the lower limbs is increased, this child will be standing earlier as compared to sitting earlier. So this would be a deviancy out of sequence attainment of the milestones. And lastly, we have certain red flags. What are these red flags? The guys you should not date, right? The red flags, the guys you should not date. These red flags are actually the time points beyond which, if that developmental milestone has not happened, we have to go for formal developmental assessment, because it could be a developmental delay, it could be a deviancy, it could be a dissociation. So let's talk about the gross motor milestones first. Sitting with support, standing with support, walking with support. Sitting with support, tripod position, we all know, comes at 6 months of age. Standing with support comes at 9 months of age, and walking with support, that is coming at the first birthday of the child, 12 months. So when would it be a red flag? Follow the same table of 3. 6, 9, 12. So red flag will be 9, 12, 15. If the child is not sitting with support by 9 months of age, it is a red flag. If this child is not standing with support by 12 months of age, it is a red flag. If the child is not walking with support by the end of 15 months, it is a red flag again, right? So this is the red flag for gross motor milestones. For fine motor, we know immature pencil grasp should come by 9 months of age. If it has not come by 12 months, this is a red flag. Social smile should come by 2 months of age. If it has not come by 5 to 6 months, it is a red flag. And lastly, monosyllabic babbling. Monosyllables, comes at 6 months. If monosyllables have not been there till 12 months of age, it is a red flag. So these are the important red flags that you should know. After that, once we have red flags with us and we want to go for thorough assessment, we have certain battery of tests. We have screening test and confirmatory test. The important screening test for your exams are Baroda developmental screening set, Trivandrum developmental screening set, Denver test, and good enough drawman test. Remember these 4 screening tests: Baroda, Trivandrum, Denver, and good enough drawman test. And confirmatory tests are Bailey's test, Wechsler's intelligence test, and Vineland adaptive behavior scale. So this completes your developmental assessment. So with that, we have discussed the normal growth pattern, the assessment of growth, the normal development, the assessment of development. If you have any doubt regarding this session or anything that you want me to include or add, I'll be more than happy to help. Otherwise, we can just end this session. Is there anything that you want me to discuss over here? Otherwise, we can wrap this session. Okay, so I think there's no such doubt. This growth and development is a very important topic. Make sure you go on and revise this. This should be on your fingertips if you are planning for any of the exams, be it FMG, be it INI, be it NEET PG. Right? And if there is any doubt, we are here to help you. You can reach me out through Telegram, through Instagram. I'll be more than happy to help. So with that, let's wrap up this session. Thank you for listening. Have a good evening.